You've made the huge decision to have surgery, and now you're overwhelmed with all the things that you need to get done before then, or maybe you're beginning to feel apprehensive about the moment you'll be asked to lie down on this bed. Whatever you're experiencing is totally understandable because going through surgery is a big deal. And in this video, I want to share with you 3 things to help you get ready that your doctor or surgical team probably didn't tell you. And not because they're trying to hide anything, but because these aren't things that I learned in my 20 plus years as a practicing orthopedic surgeon. These are discoveries that I made when I was in your shoes, recovering from neck surgery myself several years ago. So let's get to it. Number 3, make a playlist. First, a confession. I know that mindfulness meditation is a powerful tool with great health benefits. It decreases anxiety, lowers our heart rate and our blood pressure. It's even been shown to improve wound healing. But I am a terrible meditator. I'm inconsistent, I'm easily distracted, I get fidgety and frustrated, and usually end up more annoyed after the session than when I started. And even though I know this about myself, I downloaded a specific guided meditation for injury recovery that I plan to listen to every day after surgery. And part of it involved moving the injured part. So I would visualize myself rotating my head and flexing and extending my head. And I have to admit, those first few weeks after surgery were rough. I was having a hard time with pain. And every time I listened to this recording, my whole body would tense up because I just knew that if I tried those things in reality, I'd be in terrible muscle spasms. So my meditation efforts were actually making me feel more tense and more anxious. And I kept at it because the studies said that it was a good thing. But thankfully, one day my partner just said to me, "Stop it. What are you doing? This is insane. You're clearly not helping. Why don't you just try something different, like listening to music?" And that was the perfect advice. So I put several songs together in a playlist, ones that I knew were calming and that had a deep bass register that I could almost feel resonate in my chest. And I would lie down and I'd listen with noise-canceling headphones and just get lost in the sound for about 10 minutes. Later, I found that there is evidence to support this. Not only does music help us slow down and get calm, it can improve surgery recovery. This 2015 Lancet review showed music decreased anxiety and it lowered levels of postoperative pain and the need for pain medications. So the positive effects I was trying to get through meditation, I was able to find through listening to music. I put links in the description below to the first 3 songs in my playlist. Pentatonic's recording of Leonard Cohen's Hallelujah, Ben Harper's Blessed to be a Witness, and Pink Martini's version of Bolero. I dare you to lie down and listen to these 3 songs and not feel more relaxed. I don't think it's possible. Number 2, set your speed dial. This recommendation is an antidote to what I tried to do, which was go it alone, especially when things got rough. Asking for help is arguably the most difficult part of going through surgery, or dealing with any illness for that matter, but it's also something that we can all stand to learn. Your surgical team will most likely require you to have a caregiver with you for at least the first day or 2 after surgery from a safety standpoint. Setting your speed dial is different from arranging a caregiver. It means finding a friend who is willing to answer their phone at any hour. Ideally, you won't ever need to call them. But if you're having a difficult day or a particularly rocky moment, this is someone who you can reach out to who will offer you encouragement, tell you a joke, or even just be a sympathetic ear. It's preferable that this person is not a family member or a close loved one, because when you are stressed and in pain, they will be dealing with their own stress and pain from seeing you in that situation. So it's better to have a super steady friend who you can call at 2 a.m. when you're feeling miserable and your brain has been hijacked and is telling you that things will never get better. And in terms of asking for help, one way to think about it is to reverse the roles. And how would you feel if a close friend asked you to be their 24-hour support person? I think most of us would be incredibly honored because it reflects their trust and their confidence in us. And it's one of the privileges of being a friend, or even just being a human. Number 1, face your fear. Sounds daunting, I know, but what I have in mind isn't as difficult as you might think. All it takes is a piece of paper and a pen or a pencil. Even better, a journal, which is just a bunch of pieces of paper bound together. And full disclosure, my consistency with keeping a journal is on par with my success at meditation. But writing during my recovery helped me reach a breakthrough in coping with that first tough 2 weeks. If you haven't already heard of the pain scale, your surgical team will teach it to you at some point. It's a 0 to 10 scale to measure pain intensity that helps determine when you're in the hospital the amount of pain medications you might need. One morning, once I was already home and I was writing about what was going on for me, I realized that I was definitely experiencing pain and stiffness and discomfort, but layered on top of that was an absolute mountain of fear. At that point in my recovery, the pain I was having was worse than it had been before surgery, and that was the reason I'd even decided to have surgery, because I'd been having pain for a year. And there's no way around the fact that surgery is traumatic to the body, and so it can happen that pain is worse for a time period before it gets better. And I knew that on a rational level from decades of taking care of patients going through this, but in that moment, I was overwhelmed with the fear that this was my new normal and the fear that I'd made a mistake by going through surgery at all. And this fear and anxiety triggers neurochemicals that amplifies pain. So unconsciously, I was making things worse. I was feeding into that vicious cycle with these what-if scenarios. And fortunately, I had a revelation as I was writing about it that I could put a number to the pain, and it was about a 4 on a scale of 10. But my fear was about a 9 on a scale of 10. And distinguishing between the two helped me realize I can take a Tylenol for that pain. And for the fear, there's no fear pill, unfortunately, but what I could do was just bring myself back to what was true in that moment. And I knew that it was too soon to worry that this was my new normal, and it was too soon to second guess my decision to have surgery, which I couldn't undo anyway. So for that, I could go listen to music or phone a friend if I needed to. But the writing itself helped me distinguish fear from pain, and it was a critical turning point. From then on, when I was experiencing pain, I would differentiate the pain level from the fear level, and I would put a number to each and write them down. And that alone helped to decrease both. And while we're on the topic of fear, if this information has been helpful to you, don't be afraid to tap the like button. I promise it won't hurt a bit. Writing also helps maintain perspective. Recovering from surgery is a roller coaster with inevitable ups and downs, and when we're mired in that experience, days blend together, so it can be difficult to monitor incremental improvement. And what you write doesn't have to be daily 1,000-word essays. You can just do a bullet point list or a sentence or two, but having reference points to look back on 2 days, 2 weeks, or 2 months later if you need it can help give a picture of your overall trajectory. And usually what we find is it's much better progress than we thought. There's also value in the writing itself as a way of taking the worry and negative thoughts that spiral in our brains and transferring them externally onto paper. And the simple act of writing has been shown to reduce anxiety and stress. One last piece of advice in your recovery process. As much as you can, try to trust your body's innate capacity to heal. When we have a paper cut, it hurts like crazy and it's distracting. But we don't lie awake at night worrying, is it going to heal? Is it going to get infected? Is it going to be a problem for years down the road? Because we have enough experience with paper cuts to know they get better. And like magic, because it is magic, a week later, usually we've forgotten about it. Obviously, surgery is much more invasive than a paper cut, but our bodies are amazingly resilient and can ramp up for that large-scale healing. So, as best you can, try not to question that or doubt it. Just be gentle with yourself and give yourself time. I wish you well, and we'll see you soon.